Thank you. And we're live now.
All right. Mr. Clerk, you can go ahead and call the roll. We'll call this meeting to order of the Pandemic and Disaster Response Committee together. Mr. Clerk, call the roll.
All right. Commissioner Jackson,
Here.
Commissioner Gage Watts,
Here.
Commissioner Epperson,
Here.
Commissioner Young, and Commissioner Johnson.
Present.
All right. You have 4 of your 5 members are present. You do have a quorum.
Okay, and I'd like to note that I also see Commissioner Cawthorn is logged in with us as well, and is welcome to participate in discussion. At this time, we'll have our invocation by, if Commissioner Epperson doesn't mind doing our invocation, followed by our Pledge of Allegiance by Commissioner Gage Watts.
Thank you, Mr. Chairman. Let us all bow, please. Our Father, who art in heaven, hallowed be thy name. Thy kingdom come, thy will be done on earth as it is in heaven. Give us this day our daily bread, and forgive us for our trespasses, as we forgive those who trespass against us. And lead us not into temptation, but deliver us from evil. For thou art the kingdom, and the power, and the glory forever. Amen.
Please say the pledge in unison with me. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, I'm sorry the share screen is sticking. That should be back to normal now.
It's all good. Thank you, Commissioners Epperson and Commissioners Gage Watts, for our pledge and invocation. Mr. Chairman, back in your hand. Mr. Clerk, we're back in your hand.
We're at agenda additions. I'm not aware of any proposed agenda additions today other than what's in the section listed. Are you?
No, sir. Any committee members have any agenda additions at this time? Going once, going twice, gone.
All right, seeing none, we will move on to the next item is a motion to approve consideration of items under Louisiana Revised Statutes 42:17.1. If we
move for adoption, Mr. Chairman.
Okay. There's a motion by Commissioner Epperson, second by the chair, to consider those items. Is there any discussion? Is there any objection to our consideration of those items? I hear no objections, Mr. Clerk. That passes by unanimous consent. We go on to the next thing.
Okay, and that is just to remind you that this is also the place where your certificate of teleconference is attached. No action is required. And that brings us to public comments.
Okay.
So we have not received any electronic public comments. Would you like me to go ahead and give out the phone number in case somebody would like to call in?
Sure. Thank you.
Great. That phone number is 318-226-6596. Again, 318-226-6596 is the phone number to call in if anybody has public comments.
We'll open that up for a couple of seconds, see if anybody chimes in, and if not, we'll go ahead and we'll close it in a couple of seconds. And if you excuse me, I'm looking down. So if I look like I'm looking down, I'm looking down. I'm looking at another screen at the agenda.
Mr. Chairman, I have my hand raised.
Okay, Mr. Commissioner Epperson.
Yes, sir. I would like for this body to take up the issue regarding the Metropolitan Planning Commission meeting virtually in the future. It's my understanding that they are meeting virtually with a pre-application conference, And I think the citizens of the parish should be afforded the same opportunity. Many of you may be aware that there is a variant and a mutant strain of COVID that's going about. And it's my understanding, I think I saw in the news the other night where a city council person that I wasn't aware of had suffered COVID meeting in the same chamber. And we should, our citizens should be first and foremost the same as our employees and any applicant that wish to do business with this parish. And on an item close to home, the entire family of my younger brother, 5 people in his household now, are down with COVID. Thank you, Mr. Chairman.
Okay, and I'll second that motion. At the appropriate time, well, hold on, let's do something real quick, Commissioner Epperson. Did we have any other comments, Mr. Clerk, or did anybody?
We've not received any calls.
Okay, so what we'll do is we'll go ahead and we'll take up this agenda edition. I believe we have to open it up for a public hearing at this time for that agenda edition.
Just I'm sorry, could I ask just for a clarification real quick? My understanding of Commissioner Epperson's comment was that he wanted to see this addressed in a future meeting, or was he?
Pick it up today, Commissioner?
No, sir, in a future meeting. I didn't.
Oh, okay, I was ready. Okay, I thought you wanted to do it as an agenda edition. Okay.
No, sir.
Okay, all right. Well, you let me know. We can take it up whenever. I was prepared to do that today if you're ready to move. Just let me know when.
Okay, that brings us to new business. Our first item is an update and discussion from administration regarding the U.S. Treasury COVID-19 rental assistance guidelines.
At this time, Mr. Clerk, we're going to move on from that one. Treasury has not released the updated guidelines. My understanding is that those guidelines will be forthcoming. I had hoped that they would have been out by today, but they have not posted unless administration has received them, unless administration has anything. But I wouldn't want to speak to any guidelines. It would be premature to speak to them without having the updated ones. So does the administration have any updated guidelines?
No, sir. The administration does not have anything further than what we provided on last commission meeting.
Okay, that brings us to 6.2, which is an update on COVID-19 in regards to public health.
Okay. We don't have Martha White, but we do have Mr. Chris Kelble, who is with us from the LSU Health Medical School, Health Science Center. And so I would like to turn things over to him at this time. And Jeff, we're going to have him talk about if he's comfortable talking about the public health. He may not be, but also vaccination plan and a community testing.
Oh, okay.
He will, we're in his hands at this particular time.
Thank you.
All right. Good afternoon, everybody. First off, let me thank Commissioner Jackson for the opportunity to visit with you all again today and to share with you some of the recent data regarding our efforts here at LSU Health through the Center for Emerging Viral Threats. I apologize, I'm losing my voice, so if I sound horrible, I'll try my best to project. Mr. Everson, can I share my screen? Yes, I can. Excellent. So I'm going to take a few moments here because there is a lot of information that I gather that perhaps maybe you all would like to know since we last visited. And there's a couple of other things I want to show you after this brief slide presentation that are actual data and links that you all can go to and you can point your constituents to at any given time, the websites at LSU Health. So we're really trying to provide as much information as clearly and as transparently to the health or to the community as possible. So this is just some highlights that I'll read to you, but kind of give you the upshot. As many of you know, really this initiative started back in March of last year, around March 10th, if I recall correctly, largely because there was no ability to test during the beginning of this pandemic, and none of the commercial kits were available to do that. So our institution rose to the occasion and set up a clinical CLIA CAP certified laboratory in conjunction with the assistance from the Louisiana Department of Health. The governor's office was huge. And in fact, you all were actually vital, indispensable, I would say, in helping us get out to the community to be able to do testing. So since then, back in December, we converted the EVT lab to something that's now called the Center of Excellence for Emerging Viral Threats. This is a very big deal because this has received approval and scrutiny by the LSU Board of Supervisors, as well as the Louisiana Board of Regents. And they gave us a contingent one-year approval for a Center of Excellence that has never been done before. Usually a center has to go through 4 years or so of accomplishments, accolades, et cetera, to get a Center of Excellence designation. But because of all the things that we've done and because the major commitment, not only by the institution, but by the community is there, this has really helped us establish a foothold here in Shreveport for how we handle viral threats. And of course, we view the commission as a vital and indispensable partner in this regard. As you all know, we also established convalescent plasma therapy with LifeShare. We were the first in the state to do that, still helping LifeShare do that to this day. That's been a very successful program. We still have more than 20 active clinical trials underway while the vaccines are rolling out. This disease, as Commissioner Epperson and many others talked about, is a very, very serious disease, and we need to identify ways to treat it. One of the important things to recognize is that from March to today, we have performed 1 out of every 3 tests that have been done in LDH Region 7. That's huge. That's 1/3 of all the tests, and that's taking into account all the hospitals in the region. So essentially, this effort that we've done in conjunction with yourselves and LDH really has provided testing capability for nursing homes in the community. And I'll show more about that in a moment. In addition, when you consider Region 7 and 8, which is essentially all of North Louisiana, we've done 1 out of every 4 tests, which is quite sizable as well. So we still are reaching out to Region 8 and trying to help them as much as we can. One of the things that I think it was Commissioner Epperson mentioned a moment ago is the issue of the different virus strains. I'll talk about that in a moment, but I want you to understand how important what we've done here for viral sequencing is. As we all know, the United States lags in sequencing the virus. Sequencing the virus is important because it identifies new variants of the virus that come out that may resist vaccination or may be more transmissible or maybe more deadly, things of that nature. But by and large, the best out there in the world that's done sequencing has been the United Kingdom over in England and Scotland, Ireland. They've been able to sequence roughly anywhere between 5 to 10% of all the positives that they have. Here in our case, we've actually sequenced 25% of all the viral positives. So as I can tell, and we're not walking around broadcasting this, so we have a very robust viral sequencing surveillance program in place. Just to give you an example here, we've sequenced 65% of the Louisiana state sequences, and a recent article that was in the South Carolina Post and Gazette, and then also in Forbes and Bloomberg, all 3 highlighted that the reason why the Southeast is doing so well is because of Louisiana. And it's because actually us here in Louisiana that have contributed to this. As we heard a little bit ago, there was questions about vaccines. So far, we've administered 8,206 vaccines. And as many of you have seen in the news recently, there have been other healthcare systems that have come together with us to help figure out ways to disseminate and distribute vaccines more broadly. And I'll talk about that in a little while. Lastly, we've established a biosafety level 3 facility here at LSU Health Science Center that actually will help us perform research on the virus so we can even figure out how things are happening, how diseases are caused rather. But we won't talk much about that. So there's been a lot of activity, and this is still less than a year, ladies and gentlemen. So what about a summary of community and nursing home testing? So I think I might have mentioned the last time I was with the commission, we had been able to develop maps and tracking algorithms and data engines to be able to follow where we're doing testing. And so this shows you a snapshot here of testing here that the EVT lab has done. So far to date, back from the end of March till today, we've done 255,000 tests. When you take that number of days and you average that amount of testing, that's roughly about 1,000, anywhere between 850 to 1,000 tests a day. So it's been very huge. And as you can see here, this map illustrates to you the largest parish that's received the most testing, obviously, is Caddo Parish. Bossier Parish is number 2. And then we've done a wide range of testing in other parishes here in Region 7 as well as Region 8. The important thing to note here is that early in the pandemic, we were called upon by Baton Rouge, called upon by Lake Charles to actually do testing for them because they couldn't do it. So actually our Center for Emerging Viral Threats has actually done testing in 58 of the 64 parishes, representing 90% of the state of Louisiana. The panel here on your right-hand side just illustrates to you the zip codes. So that was one of the big questions that the commission had early on, and we submitted a report. And now we can go down into specific zip code regions and determine the percent positivity there, as well as the number of tests that have been done there. So we have a tremendous amount of data and ability to look at specific regions and determine where things are happening with the virus. So this slide here illustrates to you now the nursing home testing. And this is important because as we all, or no, this isn't nursing home, sorry. This is an aggregate of nursing home and community testing. So this is all the testing that we've done through the lab so far. You can see when you look at both the nursing and the community regions, it started off at 23%. And then over time, as we ramped up testing, which is here in the bar graph, you can see the percent positive goes down precipitously over time, which is exactly what we want. That was the goal when we were out front of the David Raines community clinic that day. And I said the idea was to test, and that's indeed what we've done. So you can see now routinely we test somewhere in the neighborhood of about 8,500 to 9,000 tests a week, which really does allow us to keep a hold of this virus in the places that we go test. Now, what about community outreach itself? So you may be thinking, well, Dr. Keble, this doesn't make sense because we had a surge in the virus. Why, if you're telling me we got it under control, why is it still out of control? Well, this is illustrated to you here in this graph. So again, the bars here illustrate the number of tests that have been ran, and the line illustrates to you the percent positives. And you can see we were pretty hot for a little while during the holiday season, and then we've come back down most recently. But the thing that I'd like to point out to you is that we have established places that we go to regularly every day of the week and offer free testing to people. Sadly, though, most of the time, a lot of folks don't really go out to get tested until they feel like there's a problem. And as you can see here at the beginning of the pandemic, there was a lot of community testing that started up. And then when everything seemed to be kind of okay, we hit the summertime months, kids got out of school. All of a sudden, people really got concerned because the viral positivity went up. So community testing went up as well. Then we went back to school. And when we went back to school, it was kind of out of sight, out of mind. But the virus was still there. It wasn't going anywhere. And we still needed to do testing, but we just sat there at each of the sites each day of the week, and a lot of folks didn't come. And then more recently, as you can see, as we entered the holiday period again, you can see people got tested again because they wanted to go visit their family, want to go visit their friends, even though maybe they, were getting COVID fatigue. Well, we got a little bit more testing going on here. And then it dropped a bit right during the Christmas holiday time, as you can imagine. And then it picked back up after the new year. And so now you can see the testing numbers have fallen off again. One of the things that we really would love to do, not only with yourselves, but with others in the future, is figure out a way to continue to let the public know that there is testing available to them and that they can come out and they can get a test. And it's easy and it's simple. and they get the results turned around to them specifically, and certainly within a time frame of 24 to 36 hours. So what about nursing homes? This data is really interesting, and actually we've been delighted to see it. Again, when we started off, it was at 16.67%. It went to as high as 38% during the middle part of April. This is when the governor was really quite concerned, and Dr. White, in conjunction with Dr. Van Cherry on our end, we put in place a robust and very clear testing program for the nursing homes. And as you can see, the nursing home testing ramped up very significantly over time, and the percent positivity fell to less than 2% for the majority of the time period that we've been experiencing this pandemic. And in fact, over the past recent weeks, it's been below 1% or around 1%. This is fantastic. We are an example of what to do in the nation. And in fact, many different municipalities, many different health departments have come and asked, how did we achieve such good control in the nursing homes? And this is how. So I'm going to take a moment and tell you a little bit about viral sequencing, because I think that's important for everybody to understand, because that's made the news media quite a lot lately. And I think that understanding what that means is critical. And this just shows you here a map. And there's a website down at the bottom. This is the website I was talking about, where we've done all this sequencing of the virus. And the sequences that have been done here are in orange circles. And then there are the orange lines that go out across the nation. Believe it or not, that's where we have actually had people go and spread our virus to other places. So we've been able to identify a unique strain or a unique lineage of the virus, and then it's been taken across the country to all these different places. Now, one of the things that's really critical when you start to look at the state of Louisiana is you can see here in Shreveport, we've done a very significant amount of testing, as I mentioned earlier. New Orleans has actually probably done much lesser amounts. Baton Rouge is kind of in between. But as you can see here, the connection between Shreveport and Baton Rouge in terms of the virus going back and forth between the cities is pretty clear. And the virus in Baton Rouge coming up here to Shreveport, but not as much, if you will, between New Orleans. And this is really important, because what this does is this gives LDH, as well as those of us in the healthcare space, an idea of where these viruses are going. And that's critical, because if we don't know where they're going, it's hard to figure out, say, for example, where a certain mutant is or a certain variant is. And I can tell you all today, we just got our last batch of 387 positive viruses sequenced last night. And so far, we have not seen in any of the sequencing that we've done, we have not seen the UK variant, we have not seen the South African variant, and we have not seen the Brazil variant. That does not mean that they're not here, but thus far, we've not seen them. And the key is to make sure we have a robust genome sequencing program in place to do the surveillance so that we can identify them if they do show up. So this shows you kind of the idea of lineage of a virus, because one of the questions we get often is says, well, if you don't have any of those variants here, well, then why in the world is the virus so problematic? Why is it spreading so quickly? Well, the reality is, and I don't have any strong evidence to suggest, but the evidence maybe is pointing that way, is that we might be creating our own variant. And the reason why I say that is because there are a couple of key amino acids in the virus that get mutated that make it more transmissible. And we see those mutations in the variants that we identify here in North Louisiana, but it doesn't have the other mutation signatures that are typically associated with, say, for example, UK or South Africa or Brazil. And all of these orange dots that you see that show these little branches, those are all different variants that come from North Louisiana that we've sequenced. That's a big deal, because that means this virus is indeed changing, and we have to constantly follow it. So what about vaccination? So as Commissioner Jackson said a moment ago, we really do have a strong effort to do vaccinations, again, in conjunction and partnership with LDH and Dr. Martha White. And so this shows you now a map of the places that we've been able to do vaccinations so far. And again, on the left-hand side, it shows the parishes, and on the right-hand side, it shows the zip codes. Now, mind you, we are still doing vaccination in the Tier 1A and the Tier 1B. We are being very diligent to adhere to strictly those criteria. So individuals that are 70 years or older are eligible for vaccination, as well as those that are in healthcare professions or forward-facing and dealing with individuals that are in clinics or getting some form of healthcare. Future plans for vaccination is really exciting. Of course, obviously, we're limited by the amount of vaccines that we can get from the state. But this Thursday, tomorrow, we will have a vaccination drive-through facility. At the same time, we have the ability for people to get tested at Galilee Baptist Church. This is really, really exciting because we can now offer both testing and vaccination opportunities to the citizens. And the reason why that's key is because we need to be able to do both, because that helps us screen for any of the virus mutations or the virus variants that might end up becoming resistant to the vaccine. We don't know that they will, but at least we're prepared and we have a system in place to find it if it does. We're also continuing the State Fairgrounds vaccination site. And as many of you have seen, we not only collaborate with LDH Region 7, but several healthcare entities have partnered, come out to collaborate with us, being Christus, Willis-Knighton, and others are also talking about coming to collaborate. Bossier Parish Community College, Southern University of Shreveport, their nursing programs are helping us to be vaccinators. So we're really excited about that. So I'm going to stop talking and I'll be happy to answer any questions people may have.
Thank you, Dr. Kelville. It's a wealth of information. I see Commissioner Epperson's hand up at this time. And commissioners, if you have questions, or staff, if you have questions, I'm trying to make sure I see these right. So I see Commissioner Epperson's hand up at this time.
Okay.
Did Jeff drop off? Oh, I see him. Never mind, I see him. Go ahead, Commissioner Epperson, I'm sorry.
Okay. Thank you, Dr. Keville, K-E-V-I-L.
Yes, sir.
Okay. Good information. My question is there a mandatory reporting process in place from LDH or either the CDC? Say, for instance, the parish of Caddo has, we have the registrar of voters office. We have the district courthouse. In those, we have the tax assessor, the clerk of court, all of these people, as well as the district judges' offices and staffs. As I mentioned about the city council person that contracted COVID, and I think the news story say he and his wife had been battling it, I think, for about 3 weeks. So I'm saying is, shouldn't a breakout in any public facilities where our public have to visit, shouldn't that be public knowledge and be publicized? You don't have to name the persons or not, but I mean, you know, people have to come down and pay taxes. They come down and do property searches. And it appears to me as though some people, based upon their political philosophy of whatever they think about this situation, want to keep it a secret if they counteract it. And I just think that's grossly unfair. And anywhere it's contracted, where it's in the Second Circuit Court of Appeals office in Caddo Parish, you need to tell them. If it's a state representative or a senator that's against the process that's in place, folks saying they aren't going to wear a mask, we need to publicize that.
Commissioner, thank you for your question. I understand what you're saying. And so just to make sure everybody knows, we again collaborate very closely with Louisiana Department of Health and follow all their regulations and guidelines, and more importantly, reporting requirements. So when we get a sample or a test, typically that is coming to us at one of our testing facilities. So we wouldn't necessarily know that they were at the courthouse earlier in the day, for example. We would know that they came over to, say, Galilee to the testing site to get a test, or that they went to the state fairgrounds and they got a test there. And what we do is we collect their zip code information, things of that nature, which again is what the LDH requires to be reported down to them. And we're able to give them that information. Unless it's a established, say, for example, congregate living facility, like a nursing home or an assisted living facility where people are essentially there and stuck there, we can't really assign it a geographical pin to say that's where the virus is or was. People who are able to move around, they move around. So it's kind of hard for us to find out, where they were. But I do agree with you, Commissioner. I think this kind of information as time goes on would be helpful. However, I think, that really is where LDH is at. And I would probably ask Dr. White, perhaps, if there's something that LDH could provide further to that.
Thank you.
Thank
That's
you.
all, Mr. Chairman.
Thank you, Commissioner Epperson. Dr. Kelville, as it relates to the vaccination plan, I see you, Commissioner Cawthorn, I get you. As it relates to the vaccination plan, I'm just curious about when will, or is there any timeline on when they will get to public officials? Because I'm looking at least the parish of Caddos, our employees, yes, the commissioners, our staff. There's an expectation that we're going to have public interaction, meet with the public, continue to carry out the business of public works as the whole of government. Is there any indication when we will be in line? And city council, mayor, MPC staff, as Commissioner Epperson noted, that there are some issues and people come in and out of our building quite often, quite frequently. Has LDH or the governor's office given any indication on when they expect us to be and our staff and the folks who work out in the parish that interact daily with the public, when are they expected to be vaccinated?
Right. That's a great question, Commissioner. And I do believe that is going to be very soon. I do believe some of those categories actually fall under Tier 1C, which are public servants. However, as everybody has heard, we're hamstrung by the limitation of vaccines.
Gotcha.
And one of the things we're really trying to do diligently is to get through, if you will, the Tier 1B, which are those individuals that are 70 years or older, so that we can get those individuals vaccinated. And both Dr. White and Ben Cherry have a good handle on how many those individuals are and are following that on a day-to-day basis. So hopefully in the not too distant future, that we'll move to Tier 1C, provided there's sufficient vaccines.
Okay. And the process, is my understanding now that the age for vaccination has decreased. Is that correct? From 70 to 65, and individuals with maybe pre-existing a comorbid condition, or is that?
So that's in Tier 1C. That criteria is in Tier 1C. Tier 1C has a lot of people in it, to be honest with you. And I think I would recommend everyone to go to the CDC website and read, because they when you can type in vaccination criteria or vaccination tiers, and you can see it. And so, the reality is individuals that are even younger than 65 that have substantial comorbidity conditions, like maybe diabetes or heart failure, or something along those lines, those individuals need to be able to get access to the vaccine. And they're also part of Tier 1C. So there's a lot of those individuals, a lot of those criteria there in that area.
Gotcha. Commissioner Cawthorn.
Thank you, Commissioner Jackson. Good afternoon, Dr. Kevel. I have a quick
Oh, sir.
question for you. Very good. And it may be a little involved in terms of your response medically, but a few minutes ago, you spoke to the variants that's South African and the UK. And then you also spoke to Northwest Louisiana also, and I forget the right terminology, but creating its own variant because this is a disease that's kind of ongoing. Can you give me a little bit more in sync description of how that process or that variant may be developing on our own in Northwest Louisiana, and what are, outside of the vaccine, ways for
Right.
people to protect themselves?
Yeah, no, that's a really good question, Commissioner. So let me say, we don't know for certain yet that we have our own variant that would be, the Shreveport variant.
Okay.
But it's not unheard of because, as you probably heard, in California, there's some evidence that they may have their own variant there. And so what happens as a virus goes through a population, it will inevitably change, and it will change differently in, say, our part of the world than California or than in South Africa. And what really pushes that virus to change is the host. So in other words, if the host immune system is strong and the host doesn't have a bad reaction to the virus, and the immune system of the host clears the virus, well, that virus doesn't have a chance to mutate. What I can say is that there are individuals in our community even that maybe are immunocompromised, or their immune system isn't quite as strong. And we know some of these people come in and they will test positive multiple times. So in other words, more than once, sometimes as many as 4 or 5 times over a long period of time. That virus in that individual that's immunocompromised over a long period of time has a chance to change, and it has a chance to undergo mutation. And if there's a virus that changes and happens to acquire a better ability to infect people, well, then that virus will begin to spread. But most of the time, these variants and these mutations are what we call dead end mutations. So that's the reason why I'm saying we don't know for sure if there's a Shreveport variant, because many of these viruses may mutate, but then they don't ever go on. They just stay with the host that they were created in, and then they either get better, or they get a vaccine, or they get something that cures them, and the virus doesn't survive. So it's a little complicated, but that's essentially what's happening. And what you'll see over time are all these variants that have been identified, like UK, South Africa, et cetera. Those will change too. So they may not stay the exact same over time.
Okay, thank you very much.
Okay. Dr. Kevel, the Biden administration has talked about maybe involving local government, county government, parish government, if you're in Louisiana, in the vaccination distribution plan. Is there anything that we need to probably have conversations on? Is there anything that the parish of Caddo needs to maybe get with you or Dr. Golly or Martha White to start discussing? Because as I understand it, there's a proposal to mobilize local governments to help with regard to vaccine distribution.
Mm-hmm. That's good. The answer to your questions are yes. I think we should continue to have that conversation and that dialogue. And obviously having that conversation with Dr. White is a key thing. One thing I will say and let everybody know is that when you go and want to do vaccinations, there are criteria to be a site to vaccinate that you have to meet. One of them is for the Pfizer vaccine, you have to have what's called ultra low cold storage, where we can store things at -80, which we've got 8 of those freezers now. I mean, we literally have the capacity to hold 500,000 doses of Pfizer vaccine if we were ever given it. So we have more than enough storage capacity for ultra low. The Moderna is a little better because it's just a regular freezer. But outside of the storage capacity, you also have to have the capability to enter in the data into the LDH links site, LINKS. And so that is also not trivial. And this is part of the reason why a lot of places that are administering the vaccine are telling people or asking people to register ahead of time. If they can register ahead of time in, say, for example, a registration link like we have, or some other healthcare systems have different, say, electronic medical record systems where they can register, that really helps, because then those individuals' data can be almost directly pushed to LDH links, because LDH is looking for people completing the links data, because that means the vaccine's been given. And so that's really key. And we get a lot of questions of saying, well, not everybody can do that. And that's okay. And that's part of the reason why we have extra lines, separate lines set up at the vaccination events that can register people right there on the site. So we're able to do both. So it may be, Commissioner Jackson, that in the future, once the vaccines become less restricted or less limiting, that some of those areas where there may be some bottlenecks, maybe we could certainly collaborate.
Okay. We have any other, I know a couple of commissioners asked previously at another meeting, we are talking about the community testing. Do you continue to see a need? And again, I see in the President Biden's, his American Rescue Plan, I think it looked like he wants to ramp up testing, and one would probably ask, you know, what do you ramp up to if we've already been doing a significant amount of testing? Do you see a continuation of a need, even with numbers dropping? Do you see a continued need for community testing? And two, what does it say that they're looking to ramp up or put more funding into community testing as we talk about the virus and even the mutation strains?
Yeah, so we need to sustain community testing. And in fact, we need it to increase, which is what I was saying earlier in the slide presentation. If there's a way that we could get the word out to let the public know, we're doing our best to inform people through web as well as other traditional media about where testing sites are. That way they can go get tested. And exactly like you just said, Commissioner, you know, as the vaccination takes place, even President Biden said today he's trying to shoot for the end of summer, if you will, to get everybody vaccinated. And I applaud that. However, the reality is the logistics of that may be a little more complicated. And we're, you know, mind you, we've only got about maybe 26, 27 million people in the United States infected with the virus, which means there's a whole lot of people left that the virus can be a host to. And more importantly, we don't know if any of these variants that are coming about, if they're able to infect other people who've already had the virus. So you can do that. You can get reinfected by the virus. And more importantly, even if you've had the vaccine, you could potentially get reinfected by the virus. So the testing allows us to do surveillance, to identify what the virus is doing, who's getting the virus. And even if a majority of the public gets vaccinated, if the virus still is very present, that's something you need to keep in mind and keep an eye on, because it means the virus isn't going away, and our immune system, due to that vaccine, is not able to stomp it down, so to speak. So I think testing is going to be here in some capacity for a while. I would be shocked if it went away totally by the end of the year. I think we'll have some kind of testing still ongoing. What that looks like, I don't know, because hopefully the vaccination program will speed up and hopefully the vaccines will be done by the end of the summer, but we have to wait and see.
Okay. And mitigation efforts, I know I may be asking you to put on a public health hat, but any ongoing mitigation efforts you see?
Yeah, so the same things that we've typically been doing, which is wearing masks. I know I don't like a mask any more than anybody else. I mean, it's probably the most annoying thing to have to wear, but I wear it because, you know, it's clear the science is there. and it helps reduce the spread of the virus. And then social distancing is very important. And the other thing, obviously, and we don't talk about it as much, is good hygiene, hand washing, things of that nature, being in well ventilated spaces. All the things that we've heard before are the same tools that we have available to us to continue during this remainder or the however long the pandemic lasts. So and the other thing is, I will say, just to drive home a point a little bit more, is that we know now the virus is only spreading because of community disbursement. This is not happening at nursing homes. We've got the congregate living facilities locked down. Even in prisons, we've got that very well controlled. So the vulnerable people, the vulnerable populations, because they're restricted in a space, we can keep them safe. But it's hard, as Commissioner Epperson mentioned a moment ago, when somebody has it and just decides, well, I got stuff to do, so I'm gonna go walk around and do all these other things. And if they're not wearing a mask, well, you get the picture, they're gonna spread the virus. So it's those kinds of things. And limiting the number of people in a space is obviously very helpful. So it's all the usual things.
Gotcha. Anybody have any more questions for Dr. Kelville at this time? Doc, I don't see any more questions for you.
Okay.
We appreciate it if you could. I think you said that you had a link or something that had a website with all the public information that
Yes.
y'all want to share. If you could send that to our clerk so that we can share that information with commissioners so they can share it, as well as post it on our webpage as well, to
You
be
bet.
able to get that information out to the public.
You bet. If somebody can email me, I will respond back to them with all those links right in that response email.
Okay. And would it be okay to share your presentation to link your presentation, or did y'all not want that?
Let me double check with our
Okay.
PR people and make sure they bless it, because I don't see any reason why not myself. This is all useful information, and I'll double check with Ms. Babbitt and I'll let you know.
Okay. Yeah, I agree, particularly as you talk about that zip code information, making sure folks know. And I think the more information people have, the more informed our community is. I am starting to see more people wearing masks. Unfortunately, I think it came at a cost of unfortunate lives lost, where people kind of woke up and realized it. But I did see Sunday where we saw where these championship trophies are being presented, and you have entire teams. That's, people don't realize that's a powerful message when you have entire football teams standing, receiving trophies, championship trophies, and they're masked up, not complaining, follow CDC guidelines. It's subliminal, but it definitely sends a message to the public, and I don't know whether they know it or not.
Right. Agreed.
Well, Doc, I appreciate you. And if you don't have any more, if you don't have anything else for us, we'll let you get back on with your busy day. Let Dr. Golly and the entire team know how much we appreciate the partnership, and we'll continue to have you come down. Hopefully we'll get Dr. White to give us a update from Region 7 LDH.
Sounds great. Well, thank you. And thank you, everybody. If anybody ever needs anything, please don't hesitate to ask.
Thank
Have
you.
a good day. Bye-bye.
Doc. All right, Mr. Clerk.
Okay, the last item on our agenda is just adjournment.
All right, I did want to go back real quick. Miss Bryan, is she here? Did I see her? Okay, I still see her. Yes. You mentioned that administration, you said that y'all were still standing by what y'all said on last week with regard to the update.
I said we had no additional information to provide today.
Gotcha. Did y'all check with the city of Dallas? I just got a note that they just passed theirs. Were y'all able to make contact with them just yet?
We have made some contact with them to gather information on their program. It is
okay. Okay, and then there's a county in Arkansas, Washington County, that also had a similar setup, Washington County in Arkansas. So I don't know
Okay.
if I want to try to reach out to them as well. I think they are probably just about, I know, of course, Dallas, couple million people there, but I think what this Washington County is just north of Arkansas, and I think their demographic may be a little bit more similar to ours with regard to population as well as racial makeup to Caddo Parish. So we may want to
Okay.
reach out to them. And I think the person who, there's a judge, and I think his last name is Woods, either Woods or Woodard, but Judge Wood. I guess they call them judges up there as opposed to commissioners or jurors. He's Judge Wood
Okay.
in Washington County.
All right. We will reach out.
Appreciate it. Thank you. Commissioner Everson. Yes, sir, Commissioner Everson. You're on mute if you're talking to us. Maybe that was from earlier.
I just asked him to unmute, but I don't see any.
I don't know. He looked like he had his bathrobe on earlier.
I may have stepped away a minute.
Okay, well.
Move to adjourn.
Oh, okay, I'm unmuted.
There he is. Okay.
Okay, I just wanted to commend our president on having a vision to do this ad hoc committee. Very informative and timely and needed. And I want to commend you today, Mr. Chairman, for a good meeting. And with that, I motion to adjourn.
Thank you so much. And I echo those sentiments, and we'll look forward to a productive year as we are needed. With that, we will adjourn at this time. Thank you.